Hey guys, how's everybody's doing? Once again, thank you for joining us on CPR on the Reels. I'm getting a lot of questions in regards to compressions. When it comes to compressions, a lot of people are asking me, am I conducting these compressions in the proper place on the patient, right? When we are conducting these drills with compressions, you need to make sure you have what we know as the landmark position. Where is your hand? And also, when you're conducting compressions, is there a way for you to conduct compressions where you're able to continue the quality of your compressions and keep it to the place where once you do deliver compressions, are you able to continue the quality of compressions where that circulated oxygenated blood is going throughout that body, that patient's body in the proper way, right? Where are you supposed to be compressing? How can I compress, right, to the tune of 100 to 120 beats per minute? For the adults, how deep am I supposed to go? For a child, how deep am I supposed to go? Is there a difference? And also when it comes to infants. And last but not least, right, should I be counting out loud? Is that even a thing? Right, so all of these questions are very important to tackle. Let's go ahead and look at these different questions and whether it actually matters. And believe it or not, it actually does. And I'm going to bring you guys into my world. After we do show up together with paramedics, ALS, EMTs, why we need to make sure you guys start compressions. If you are a lay responder, if you're a parent, what is so important about compressions and why we're drilling compressions during our courses. It's a big deal. Great. So let's get started. Extending your dominant hand, interlace your fingers and make sure your arms are straight by locking your elbows. Place the middle finger on the distal nipple and then place the heel of your palm in the lower portion of the sternum. As we begin, we're first going to make sure the scene is safe for you and know which resources are available to you. Then you tap both shoulders to check for responsiveness. Place the hand on the forehead, open up the airway. Then you place 2 fingers on the carotid artery and you listen for breathing while observing the chest for chest rise. If there is no breathing, no chest rise, no response, call 911 and ask someone to get the AED immediately. You then extend your dominant hand, interlace your fingers as mentioned, lock your elbows, and you're ready to begin the compressions by using the body weight to compress to a minimum of 2 inches for the adult at 30 compressions in 2 breaths.